Welcome to PodcastRx, a production of Diamond Pharmacy Services. This is a show about pharmacy, but don't let the title fool you. While we definitely talk with pharmacists about medication topics, we also sit down with nurses, technicians, and other pros to discuss relevant issues in corrections health, long-term care, and so much more. Whether you're a pharmacist, a practitioner, or just find these things fascinating, this is a show for you. On this episode,
we can't say enough about the efforts of healthcare professionals during the COVID-19 pandemic, from the doctors and nurses tending the ICU, to staff in long-term care facilities, and of course to the pharmacists now vaccinating patients. But if there's a group of professionals that might get a little lost in the shuffle, it's respiratory therapists. While it's a given that respiratory therapists would play an important role in fighting a respiratory disease, what might not be so apparent is just how deeply the counsel and comfort of a respiratory therapist is woven into patient care.
I tell my patients, you're never alone out here with this equipment. You're never alone. We're a phone call away. You have a support system there for you. Because it is scary, again, you don't feel good. Any patients, not even just COVID, anybody that is on oxygen is not feeling well. It's all new to them. They're scared of it. I always remind them, you are not alone.
Senior respiratory therapist Judy Tomayko from Diamond Medical Supply joins us to discuss the effect of the pandemic on her past year in the profession. She shares her experiences with improvising oxygen care for nursing facilities.
They didn't know that they could do things so that the patient could stay there instead of being taken to the hospital.
Infection control.
I remember at the beginning, I'd look at the CDC website in the morning. 2 hours later, the recommendation changed.
Workarounds for home visits.
Training on patient porches.
And much more. And we also talk about the positives to come out of this pandemic, including for the respiratory care field at large. I'm Adam Campbell, and this is PodcastRx. Judy Tomayko, welcome to PodcastRx. It's your first time here on the show. We've had a lot of repeat guests lately, so it's good to have a fresh guest on. So if you could, for the listeners, can you please tell us what you do here at Diamond?
Well, thanks for having me. And my name is Judy, and I'm one of the respiratory therapists here at Diamonds. And we do a typical group of respiratory services and equipment, including oxygen, nebulizers, sleep equipment, tracheostomy, and smoking cessation, the full gamut of respiratory care.
Now, before I started working here, I didn't have a very in-depth understanding of the respiratory care profession, respiratory therapy. I just always looked at the oxygen end of it, but you do so much more than that. So I'd like to ask, what are things that you notice people tend to get wrong about what you do as a respiratory therapist?
Here at Diamonds, with the home respiratory therapy group that we have, it's a little bit different than what the hospital therapists do. The hospital therapists are dealing with the acute ill patients, trying to get them better, trying to educate them and get them home as quickly as possible. At Diamonds, with our respiratory department, we are more at coordinated care with the doctors, with the visiting nurses, with the family. We become part of that group to help improve their quality of life. So we want to know what the individualized goals are for that patient. Do they want to go out and garden? Do they want to go on a cruise? So we try to treat them and get them to a point that they can go out there and enjoy their life, their quality of life, and make it as easy as possible for them.
What are some things about what you just mentioned, your whole scope of service? What are some things within that might surprise people?
I think people might be very surprised how much the home respiratory therapist means to those patients in their home settings, because we are the direct link. Oxygen is a life-sustaining piece of equipment. And for that, to travel on a plane or train, to make arrangements for those patients to have the portable oxygen, to have a system available to whenever they get to their destinations. And we have a lot of patients on oxygen that are still working, and to try and make it as easy as possible, because that's our goal. We want them to continue to live their life as best as they can, as easily as they can. And I think that that's probably very surprising to others that a respiratory therapist would take that role.
Right. It's a lot bigger than the billing may make it seem.
Absolutely.
Now, of course, then have to cut to the heart of the episode and what I wanted to talk to you about. COVID-19, has upended the world in the last year, and it's a respiratory disease. So I can only imagine the effect that it's had on what you do here every day and what your colleagues do. So in a couple recent episodes of PodcastRx, we had a bit of a retrospective with a couple of our guests, Audra here from Medical Supply and also Debbie Yakubowski, where we kind of went back and discussed their memories of the time leading up to the start of the pandemic, which was around here really took off in March of 2020. So coming up on a year. And I want to ask you the same thing. What do you remember and how do you remember reacting?
I remember a lot of certain things that really stand out. I think when we started hearing what was going on in other countries and hoping that it wouldn't come here, but it did, and making arrangements, I think the hardest thing was to jump in with both feet, acquiring all the different type of respiratory equipment. We wanted to make sure that we were here to support the community and our facilities. And not knowing how it was going to spread, not knowing how many people were going to be affected, we really made sure that we were equipped. Reaching out to different vendors, reaching out to different nursing agencies, the hospital, how they're going to do it. But I specifically remember at the beginning of this, and I guess because we live in a small community, and it didn't hit us till later, we are getting calls from Pittsburgh facilities that were really being inundated with COVID. And they called, and no matter what they did for their patients with COVID, they could not, maintain their oxygen levels, no matter how high a liter flow. And they're desperate on the other end of the phone, and you're here and you can't go help them and to give them what they need. So I remember that phone call like it was yesterday. I mean, it was just really clear. And then I reached out to one of our local physicians, and he kind of, I don't want to say calm my nerves, but just said, this is what is going to be expected of these patients. They're already compromised to get COVID. These things are going to happen. There's really, unfortunately, it's going to run its course, and you got to be prepared for it. That really struck out. But I think just getting prepared with the equipment and training our patients, because things change so much. Mm-hmm. I remember at the beginning, I'd look at the CDC website in the morning. 2 hours later, the recommendation changed. No fault of theirs. It's just that as the science was following the new virus, things were evolving. And
absolutely.
So yeah, exactly. And so we had to change a lot of things, from deliveries being made, that we'd keep them quarantined from shipments, for 72 hours. And it was 24 hours. And so things changed and evolved as time went on. But that was hard. That was hard at the beginning. And yeah, just education of the staff, because we have to keep our Diamond family safe. So
Right. And Audra spoke to this when she was on the podcast a few episodes back, but how tough it was to acquire equipment in some cases. What was that like on your end with respiratory equipment specifically?
Respiratory therapy equipment at the beginning was not bad. We could acquire what we needed at that time. The second wave that hit, after Thanksgiving, more difficult, because there's a lot of people just wanting this equipment. They need it. It was crazy how much we went through, but because we have so many outstanding vendors that support us, we were able to acquire what we needed. My nightmare would be if I didn't have what the people of this community needed. Mm-hmm. So we did everything we could to acquire what we could, when we could, as fast as we could.
Right.
To make sure that Diamonds was prepared. And Diamonds is wonderful. They would do anything for the community and for their employees. They really, stepped up to the plate and helped everyone stay safe.
Absolutely. Just being an observer working here, seeing the way that the COVID task force has come together to, keep operations going and keep everybody safe has been really something to behold.
It absolutely is. Yeah, I totally agree.
I understand too that you are the infection control coordinator for Diamond Medical Supply. Is that right?
Yes.
So you spoke a little bit to it, but how difficult was it to implement infection control measures when, as you said, things were changing so often, guidances and whatnot?
Even though things were changing sometimes by the hour, we will always take the highest road. We would always do the most to keep everyone safe. Our employees, our patients, our referral services, because we're delivering to the hospital and keeping them safe. Education was absolutely vital, to the simple things of donning and doffing gloves and proper PPE to keep them safe, making sure everyone has stock. So whenever they go out and see the patients, or they go to the hospital, they are dressed appropriately and protected. And I think education was the hardest thing. And again, updating policies, updating procedures, and then following through with the education.
Yeah. I understand there was a color code system.
We do. We have a color code system for infections. Mm-hmm. And I don't know why, but I gave COVID code purple.
Yeah.
I don't know. Maybe it was a color I just haven't used yet, but it seemed appropriate. So, and it's amazing because I track the code purples since March. Mm-hmm. And it really hit the community harder than what I expected at the beginning, but hopefully we'll come out at the end.
You were just talking about the measures that were being put in place to protect the Diamond family and of course meeting the employees, but talking patients, as far as the overall patient effect in home care, personal, skilled, which you also serve. How difficult was it, and what did you and your team have to do differently?
That was difficult for our staff, not to be able to go out there and do the home visits and spend some really quality one-on-one time with our patients. We had to look at every patient as an individual. Every delivery was individualized. Every setup was individualized. But we were really successful, I believe, in finding a way to make it work. We did. We do have the ability to do team meetings with the patients or the caregivers. So if they need more instruction and face-to-face time, we can do that with them. But we also found ways of training on patient porches, outside the referral services, wherever everyone would feel comfortable and safe, but would also be able to get all the proper training and feel comfortable with the equipment. Yeah, it was definitely different. But every time you get a phone call that someone needs something, you had to evaluate the situation and how was the best way of getting this to the patient. Yeah, that was tough.
Sounds like a lot of improvisation.
It was. And our staff was wonderful because every turn they'd go here to do it this way, then we'll go another turn and have to set it up a different way. And they were so flexible and so understanding. And I have nothing but the highest regard for the technicians that deliver. They do a wonderful job. And through this whole crazy times that we're living in, they've been amazing.
Helping patients on the porch. Did you have to actually do that?
Yeah, we would do visits on the porch, those patients that would need a little bit more training. And not probably as much as I want because of the pandemic and, trying to keep everyone safe. We really had to do things a little bit differently, more remotely. Yeah. But even our patients with COVID and were positive, they were very respectful. They understood how nervous people were about getting it, carrying it, how it would affect my family. So they were very respectful and understanding and really gave it their all to understand the equipment. Yeah, I mean, it was, I'm sure, tough on them. You're getting all this new equipment and they're not feeling well. And sometimes there's questions. And they would call. I mean, we have availability 24 hours a day. So you would get phone calls all evening, all night for simple questions to me, but to them, it was nice that they had the opportunity to reach out to us and know that we're there for them.
We hope you are enjoying our conversation with Judy about respiratory care. If you live near Indiana, Pennsylvania, and you think Judy and her team could help you or someone you care about with a respiratory issue, get in touch with us. Our registered respiratory therapist will educate you about treatments and thoroughly train you to use oxygen, nebulizers, CPAPs, BiPAPs, or any specialty equipment. And just like Judy said, they will be a round-the-clock resource for you, answering all questions, no matter what time and no matter how simple. To get started, please call Diamond Medical Supply at 724-349-2830 or email rrt@diamondpharmacy.com. And now, back to the show.
among your aggregate of patients, were there a lot of COVID positives in the last year that, I mean, an overwhelming amount within, whether it's home care? I mean, you mentioned facilities, but especially in home care.
Yeah,
just thinking,
I do believe. And again, for the numbers, for the rural community that we have, there was a lot. And they were sick. They were scared and they were sick and they were quarantined and they were on their own. So when we would reach out, I'm sure it was a positive experience for them that they were able to talk through some things. It was kind of heartbreaking. Skilled facility is the same in personal care homes. They were locked down. They didn't have a lot of outside support systems and so forth. And we tried to help them out as much as we could in regards to education and how to conserve oxygen, how to utilize the equipment that they already have better. And I think they're appreciative, but they went through a lot. Those skilled facilities and the personal care homes. Absolutely. They, I'm sure that they're wishing for this to end as soon as possible also.
Yeah, went through a lot, continue to go through a lot for sure. Going back to equipment for a second, I remember that some colleagues of mine in the marketing department helped you put together a video like that, helping them improvise equipment.
Yes.
So you already said there's a lot of improvising going on, whether it's consultations on the porch, but in this in particular for the facilities, what did you have to do in terms of equipment to get things working right for folks?
Well, a lot of the COVID positive patients, they require very, very high flow rates of oxygen. And to get that, sometimes you have to, I won't say jerry-rig, but you got to do some things to hook two oxygen machines together or using different devices for the patients to wear. And so, we threw an impromptu video together, explaining that to the nurses. And we released it. And I got a lot of positive feedback from that. They were appreciative because it's something on a daily basis that they were using, but they didn't know if they were doing it right. They didn't know that they could do things so that the patient could stay there instead of being taken to the hospital. So that was definitely impromptu, but we got it out there and it was needed. The education for that type of equipment, that's where we specialize at in the respiratory field. So we're here for them. They can, call us all the time and figure out the best scenario for everyone involved.
Everything you're telling me, it's reinforcing the notion of respiratory therapists as unsung heroes. I mean, all the healthcare workers that have responded to this pandemic are absolute heroes, but respiratory therapists in particular being that one voice that a home care patient or somebody who's isolated in the skilled or personal care home can talk to, and being such a great resource. Right. I just never thought of it in that way, how deep that runs for the patients.
Yeah, that's one thing I always tell my new patients. I'm telling you, for the past 22 years I've been here, is I tell my patients, you're never alone out here with this equipment. You're never alone. We're a phone call away. You have a support system there for you, because it is scary. Again, you don't feel good. I mean, this is for any patients, not even just COVID. Anybody that is on oxygen is not feeling well. It's all new to them. They're scared of it. Yeah. And I always remind them, you are not alone. And those are my exact words every time I go out there. And they send a sense of, you get a nice little relationship with them. They trust you.
Right. Relationships are everything to get through tough times like these. You said about the equipment, like that there was a tougher time getting respiratory equipment after the second wave. How is that leveled off now? How do things look? And what equipment in particular has been difficult to get? I
think right now there's a waylay for things. There's like a 4 to 5 week, 6 to 8 week, depending on the equipment, delay. Oxygen equipment and oxygen tanks primarily. Yeah. Sleep machines, all those nebulizers and everything is good. We were able to get those things, but oxygen supplies right now are a little bit tight. Now, let's just say I'm well stocked. Yeah. I'm well stocked, and I just didn't want to be that company that couldn't take care of the community. That would have really bothered me. And I like it whenever they can call. Yep, we have it. You'll get it. You're good.
For sure.
But I think it comes a lot too from Diamonds, from working at Diamonds. You have that community feel, and the whole company is like that.
Very much it's a family-owned company, and very much a family atmosphere.
Absolutely.
Among the staff and the patients. One thing that Audra mentioned when she was on, and I should clarify, Audra Palma, the manager of Diamond Medical Supply, your boss, she had talked about, in particular, when I said equipment earlier, I should have clarified that personal protective equipment was really what we were talking about. Is that still an issue, or is that leveled off?
That has leveled off.
Good.
Getting the masks, the gowns, the shields, the gloves, yeah, everything's starting to level off.
So Judy, helping patients manage COPD is a big part of what you do.
Mm-hmm.
COPD patients are at an increased risk of developing severe illness from the coronavirus. So one of your bigger aspects, and you've said it a bunch through this, is educating patients. And of course, that's how to use equipment, the treatments. How much has infection control played into the education there? Namely, and I'm thinking from wearing masks and social distancing, there's certainly been controversies around that, as we know, but has this been a challenge for you as an educator and trying to get optimum health outcomes? Have you had to address that, get a little tough in that area at all?
I want to say most of my COPD patients have been very protective on themselves and their health, and really staying quarantined during these times and only going out when needed. And at the beginning, yes, education was huge, and the proper mask too, because there's certain masks that will actually make it harder for you to breathe. So that, I think at the beginning of this, my bad COPD patients wanted to wear the N95 masks. Those are very difficult to wear for extended periods of time. And so trying to get them on something that they can use and be safe at the beginning, yeah, that was a challenge. And also because you couldn't get a lot of it either. At the beginning, masks were gold, and it was hard for those patients, so they wouldn't leave their house. So our patients have been very good. Now we have had some patients that just kind of, they go about their life, and you do have to play a little tough love with them because it's their health and their life and their family also.
Right.
But I have to say, for the most part, our COPD patients have really been protective of themselves because they know the ramifications of if they get ill that it could lead to.
So as we're recording this, it's January of 2021. And of course, the virus is still impacting places all over the country. It's still impacting us here in our backyard. It's certainly still very much a force to be reckoned with. We do have the vaccines being rolled out at a slower pace than desired. We can say that much. And that's a whole other podcast there. But we talked a lot about difficulties from this pandemic. But from a respiratory care perspective and a respiratory therapist perspective, Judy, what have been some of the positives that have come out of these experiences?
I think there's been a few. One of them is that I think people have acknowledged the work and the knowledge of the respiratory therapist, not just in the hospital settings, but in the home care settings. Another positive is that I hope our community realizes that we've been there for them, and I think they do. I think they realize that we've been doing everything we can to keep them safe and to provide what they need. But I think the overall sense of community is probably the most positive, not just in the realm where we're at today, but between the nursing agencies, the doctors, everyone just has come together as a community, because literally we are in this all together. And if we have to watch each other's back during this time, we have to support each other, because these have been tough times, stressful times for everyone. And the sense of community, I think, has struck me the best. Everyone working together to get through this.
Absolutely. Without that, where would any of us be? So to kind of close here, how do you think this pandemic of a respiratory disease will change respiratory care moving forward?
I'm hoping that some of the younger populations realize that it's a good field to get into. They can really provide a lot of support and services to patients that really need their help. And I'm hoping that the respiratory therapist understands their need too, because sometimes they get lost in the shuffle, and it's kind of nice for people to understand what they do now. I really do. I hope that it's something that continues to move forward with the field of respiratory.
Being in the position that you've been in with patients and infection control and every aspect of dealing with the pandemic, has it changed you at all?
I think I feel a greater sense of responsibility. Not that I deserve or I feel like the world's on my shoulders, but I do feel a sense of responsibility to be able to acquire what we need to keep the community and our facilities safe and healthy. So I think that's probably the biggest thing that's changed, my sense of responsibility to the community at the large, because it was a lot. It was a lot to swallow, and you are going in there blinded. You don't know what to expect. So yeah, I think that was the biggest thing that changed me.
How do you see 2021 going forward as a respiratory therapist, as a healthcare professional?
I think we're going to come out of this stronger. I truly do. And everything is going more in a positive avenue with the vaccine coming out. And I believe people are following the recommendations better in regards to masks and social distancing and so forth. I think I think there's some sunshine coming up on our horizon very soon. I think it's really going to come together and hopefully end, and everyone can go on with their life and enjoy.
Well, Judy, we certainly appreciate the work of you and your colleagues to help us get there. So thank you.
Thank you for having me.
Yeah.
Appreciate
thank you
it.
for being on. Hopefully we'll do this again sometime. This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.
Music in this episode by Wolfgang Worley. Sound Express by Getty Images. Additional music by the 126ers and Silent Partner.